It's a very unusual from a standpoint of cancer patients because my PSA, which is a value, if it's over 4, that's kind of a sign you're starting to see trouble. And mine, I don't know if it in my life was ever below that.
Eggen says his prostate-specific antigen, also known as PSA, continued to climb. When it hit a score of 17, he decided to get his first biopsy.
Fortunately, it was very, very low grade of cancer. It was like they do like 12 samples, and it was on those 12, only 2 of those samples had hits, and it only had 5% cancer cells, and it was very low grade or regressive cancer. So all of that was good.
From there, he began watchful waiting.
So I just talked a lot with the doctors, and I said, well, let's just see what's going to happen.
Eggen says his diagnosis caused him to reflect during his journey.
I guess I feel that when you look around at a number of people at my age, you don't look at the obituary column, but you notice there's a lot of people that, from infants to a lot younger than me, so how could you feel bad?
He also added that a person's attitude plays an important role.
I think my story may be interesting because I think you'll find very few people, I don't know what the highest, but I know I asked Dr. Gillette, and people have had PSAs in the hundreds. So I'm not a record setter, but typically that number 4 is kind of the milestone. After that, you maybe want to go in. I guess I would say trust your doctors, first of all. I feel I have some great ones.
Eggen is still monitoring his prostate health and consults with his doctor and is feeling better than when initially diagnosed.
Feel good. I go to Canada fishing every year for a week and feeling great.